the biggest lever, of course, that a payer has is payment, right? And so I think it would be great to see payers pay for equity ultimately. There are programs that are being designed now around pay for equity, and I think there are a lot of good ideas in them. There are some risks in here as well, and the risks are again around incentivizing the rush to incentivize, when in fact what we should be doing is pay for gathering the data to begin with, and helping with the collection of self-identification and real and SOGI data, as well as ensuring that payers are creating learning environments for clinicians to help them actually respond to inequities that are present in the data. This is all before incentives are applied. I think once we start to think about payment differently and incentives differently, I think there's an opportunity for payers to think about actually how we might incentivize an entire group of delivery systems or providers in a region to raise the bar overall for the whole region around equity, rather than paying individual providers who will then compete with other providers to be above the median effectively, and that kind of payment system. So more collaborative incentive rather than competitive incentive is what I'd be looking for in a pay for equity program. There are two other roles that payers can play. One is actually getting the data. Payers have a lot of data around the way that care plays out, and sharing that data with their providers. We've got some examples of that starting to happen right now, where payers are gathering the data. They are helping to also gather self-identification data from their beneficiaries. And then the third area, I think, is one that I've touched on already, which is payers can, I think, support their provider communities to learn differently. How do we create meaningful learning environments and engagement strategies with provider communities to help them all collectively progress around some of these issues, rather than just seeing their stick as the payment lever. So those are three ways. I think pay for equity, help with the data collection process and the stratification process, and then support the provider community to respond to the data in a way that's constructive and not defensive.